This is a grossing tutorial video on how to process a uterus with bilateral attached adnexal structures for a cancer outside the uterus. So this is not a cervical cancer case. This is not an endometrial cancer case. This is not an adnexal cancer case, but it is a cancer not within the uterus. So right now we're looking at a uterus. We're looking at the anterior aspect here. We've got serosa here. We've got the fundus here. We've got the end of the serosa here. We've got a bunch of soft tissue here, which is all cauterized. We've got the cervix right here. And as you'll see, extending from the cervix, probably looks like it's right at the ectocervical, endocervical. Once again, that's the ectocervical, endocervical junction, is this polypoid lesion, which is most likely benign. It's got a very well circumscribed border. It's rubbery. Anyway, so once again, this lesion is right at the ectocervical os. Here's the ectocervical mucosa. We've got the anterior aspect, and we know this is the anterior side or anterior aspect because where the serosa ends and the ectocervical mucosa begins, there's quite a distance here, as opposed to this side, which is the posterior side. We've got a lot of serosa here, and the distance from where the serosa ends and where the ectocervical mucosa begins is much shorter. So note this is the posterior side. This is the anterior side. Now, there is a lot of attached soft tissue and probable tumor right here at this junction, which makes it a little bit difficult, but we're still able to see the reflection of the serosa here and the ectocervical mucosa here. So once again, the distance between here and here is much shorter on the posterior side than it is on the anterior side. Now, if we flip this back over to the posterior side, we know that if we're looking at it posteriorly, the right adnexal structures are going to be on this side, and the left adnexal structures are going to be on this side. So we've got a fallopian tube segment here, going across right here. We got the fimbria here. We got a big peritubal cyst right here. We've got the ovary here. Okay, so right ovary, right tube. Looks like there's on this side anyways, there's a crimped area here, maybe even a past longitudinal defect from a past possible tubal ligation here. We've got some scattered adhesions. There's some adhesions here and here. Like I said, we got the peritubal cysts. We've also got some tumor excrescences here, here, and here, which are looks like right on top of the ovary. Let's see if we can zoom in a little bit on that. So once again, these are actually some excrescences, some tumor excrescences here. And looking at the posterior attached soft tissue here, looks like there's a tumor excrescence or nodule right here too. Let's move over to the left adnexa. We've got the fallopian tube here, fimbria here. I can kind of palpate either a peritubal cyst or a dilated portion of the tube here. We'll investigate that here shortly. We've got the left ovary here with excrescences here, here, and here. Looks like there's probably excrescence here and some little scattered maybe adhesions here and here. So once again, we've got the posterior aspect. This is the right adnexa. Over here, we've got the left adnexa here, right ovary, right fallopian tube, left ovary, left fallopian tube. And then also what you can do is if you, by chance, get a case where you don't have the ovaries and you're trying to figure out what's the right tube and left tube, and say, for example, the posterior serosa, the anterior serosa here and the posterior serosa here are very disfigured, or there's a lot of adhesions, you can't tell which side's which. You can also use the acronym RFO in that order from anterior to posterior. So we have the round ligament here, we have the fallopian tube here, and we have the ovary here. So RFO from anterior to posterior. Okay, so it's a round ligament, fallopian tube segment, and then the ovary, and this is the right side. And we know, so not only can we use the serosal reflections for both here and here to designate and figure out what's what, if you do not have an ovary, you can always count on, or you can not always, but you can usually count on the round ligament here, the fallopian tube here, and once again the right ovary here. So this is going to be, instead of the right side, it's going to be the left side over here, if you go from anterior to posterior. Once again, on this side, from anterior to posterior, R, F, O, this is going to be the right side, okay? I may have said that wrong over here a second ago, but just remember that you can use those landmarks as well. So what we're going to do next, and I'm going to pause this while I do it, is I'm going to ink the ectocervical / endocervical soft tissue on the right side one color, and on the left side another color, and then I'm going to put a little bit of green ink over the areas of excrescences. So I'll be right back. Okay, so I'm back. I've just inked the uterus. I did the turn over to the posterior side. I did the right ectocervical / endocervical soft tissue black. I did the left ectocervical / endocervical soft tissue blue. I overlaid the areas of excrescences with some green ink here and here and here. And as you probably recall, on the posterior serosa, there's all soft tissue, but there's also an excrescence right here. So I put green ink on those areas. And the reason I did is because the pathologist is going to want to see, you know, are these truly on the outside and not within the ovary or within the tube, those type of things. But it's pretty obvious that this is these are tumor excrescences outside the uterus, and we do know that this is a cancer that's not involving the cervix, nor the endometrium, nor the adnexal structures, so that kind of makes sense. So what I like to do now is I like to, depending on how you guys do it as your practice, we have a template we use, and we always talk about the uterus first and then do the adnexal structures next. So I'm going to go ahead and cut off and divide the left and right adnexal structures and concentrate now on the uterus. Okay? Now you can always ink one side or one adnexal structure one color and then the other side another color. I just usually designate what's what in the cassettes, and that works out okay. Now what we're going to do is we're going to open up this uterus. There's a variety of different ways of doing it. The way we do it is we use scissors, and I kind of like this method as opposed to putting a probe in, as long as the scissor blades are nice and sharp. So I'm just going to cut along so we're cutting from the cervix up the right side, okay, and we're going to continue cutting until I get about right here. And then what I like to do next, so we got that lesion on the other side, we've got to kind of be mindful of that lesion over there. Turn on the water. It's always good to have some running water, especially if you have a friable tumor. So it looks like this actually might be tumor here, so I'm going to cut along here on the left side and hopefully bypass that polypoid lesion at the cervix so I can get a good look at it and a good section of it. So I've cut the uterus in half. We've got the anterior side here, posterior side here. This does look like lesional tissue. I'm not sure how well attached it is. Looks like it's attached. There's some loose stuff here. Looks like the majority of it's attached. It's kind of interesting.